Inflammation. At the end of the chapter, the student is expected to know the causes of inflammation, understand the process of inflammation, and comprehend the etiopathogenesis of granulomatous inflammation. And they should know the contrast, the differences between the acute and the chronic inflammation. Inflammation is a local response of living vascularized tissues to endogenous and exogenous stimuli. The term is derived from the Latin inflamme, meaning to burn. Inflammation is fundamentally destined to localize and eliminate the causative agent and to limit the tissue injury. This inflammation is a physiological response to the injury. An observation made by Sir John Hunter in 1795 concluded, inflammation is itself not to be considered as a disease, but as a salutary operation consequent either to some violence or to some diseases. While speaking about the causes of inflammation, there are apparently causes of diseases such as physical agent, chemical agent, and biological agents. In the physical agent, there will be a mechanical injury, alteration in the temperature and pressure, radiation injury. While speaking about the chemical agent, they include the ever increasing list of drugs and toxins. While speaking about the biological agents, the infectious bacteria, viruses, and fungal parasites. Immunological disorders, they are hypersensitivity reactions and autoimmunity, immunodeficiency states, etc. While speaking about the genetic or the metabolic disorders, they are included in gout and the diabetes mellitus, etc. Nomenclature. The nomenclature of the inflammatory lesion are usually indicated by the suffix its. The inflammation of the appendix is called appendicitis and that of a meninges is called meningitis. However, like any rule, it has its own exceptions, examples pneumonia, typhoid fever, etc. Classification. Inflammation is classified purely based on the duration of a lesion and the histologic appearances into acute and the chronic inflammation. Acute inflammation. This is an immediate and early response to the injurious agent and it is relatively of the short duration, lasting for minutes, several hours, or few days. It is characterized by exudation of fluids and plasma proteins and the immigration of predominantly neutrophilic leukocytes to the sites of injury. The 5 cardinal signs of the acute inflammation are redness, rubor, which is due to the dilation of a small blood vessel within the damaged tissue as it occurs in the cellulitis. Heat, which occurs from the increased blood flow, hyperemia due to the regional vascular dilation, and swelling tumor, which is due to the accumulation of fluid in the extravascular space, which in turn is due to the increased vascular permeability. Pain, dolor, which partly results from the stretching and distension of a tissue due to the inflammatory edema and in part from pus under the pressure in an abscess cavity. Some chemicals of the acute inflammation including the bradykinins, prostaglandins and the serotonins. They are also known to induce the pain. While speaking about the loss of function, the inflamed area is inhibited by pain, while severe swelling may also physically immobilize the tissues. Events of acute inflammation. Acute inflammation is categorized into an early vascular and the late cellular responses. The vascular response has the following steps: immediate, momentary, vasoconstriction in seconds due to the neurogenic or the chemical stimuli, vasodilation of the arterioles and the venules resulting in the increased blood flow. After the phase of increased blood flow, there is a slowing of blood flow and stasis due to the increased vascular permeability that is most remarkably seen in the post-capillary venules. The increased vascular permeability oozes the protein-rich fluid into extravascular tissues. Due to this, the already dilated blood vessels are now packed with the red blood cell, resulting in the stasis. The protein-rich fluid, which is now found in the extravascular space, is called exudate. The presence of exudate clinically appears as swelling. Chemical mediators mediate the vascular events of the acute inflammation. While speaking about the cellular response has the following stages: migration, rolling, pavementing, and adhesion of leukocytes, transmigration of leukocytes, hematoxis, and phagocytosis. Normally, the blood cells, particularly the erythrocytes in the venules, are confined to the central zone and the plasma assumes the peripheral zone. As a result of the increased vascular permeability, more and more neutrophils accumulate along the endothelial surfaces, that is the peripheral zone. While speaking about the migration, rolling, pavementing and adhesion of the leukocytes, margination is a peripheral positioning of the white cell along the endothelial cell. Subsequently, rows of leukocytes tumble slowly and along the endothelium in a process known as rolling. In time, the endothelium can be visually lined by white cells. This appearance is called pavementing. Therefore, the binding of leukocytes with the endothelial cell is facilitated by the cell adhesion molecules such as selectinins, immunoglobulins, integrins, etc., which results in the adhesion of a leukocytes with the endothelium.